it takes to bring your world to
Welcome back, everybody. On Great Look Monday, we have the opportunity to ask the doctor. And from the Aesthetic Associates, Dr. Sam Shatkin Jr. is here to talk about procedures that help when nothing else does. You could call them mommy makeovers. Dr. Shatkin is here to tell us more, and our phones are open for your calls and questions right now at 644-9840. Procedures that can help when nothing else does. This is perfect timing.
Well, you know what, really, a lot of women, and they're all my clients, they come to the office and say, well, I've been exercising and working out. I just can't get rid of all that loose skin, and what do I do? And I like to think that they're stretched to the limit, so to speak, and it's time to take care of themselves, literally and figuratively. So we can help them with that.
You can, and the specific thing we're going to talk about, although we can take your calls on anything, are tummy tucks, right? And as we say, a lot of times, most times, this is from pregnancy, and that skin, you can exercise and get the muscles back in shape, but that skin does not come back.
Right. Well, you know, we run a weight management program, and these women do their best to lose weight. They start exercising. They try to strengthen the muscles. You can never get rid of that loose skin that's hanging from that stretching with the pregnancies, and some of them are multiple pregnancies. So the abdominoplasty or tummy tuck is a great procedure. It can remove the extra skin. The surgery is about an hour and a half to 2 hours. It's not a big procedure, and the patients within a week are doing pretty well.
And this is a great time to consider it. Let's have our first picture, and you can see exactly what we're talking about. Now look at this is the before and after.
Example.
Wow.
This is a woman that had lost a tremendous amount of weight, and this is before and after. And these pictures, just to let the listeners know, some of them are provided by the American Society of Plastic Surgeons. But this is a great example of what can be accomplished with one operation, one recovery. You can imagine the self-esteem these women have after this is done.
Well, we even have some side views of this where you can just see. Look at that.
Yeah, so you see the incision, as you saw in the first picture, is fairly well concealed underneath the bikini line. So normal clothes will pretty much hide all that. And you can see a nice improvement. Are
you actually talking about like some pounds that are being removed here in skin?
Well, yeah, on someone like this, you might lose 5 pounds or more, but it looks like they lose 20 pounds.
It sure does.
It just really tightens that up, and the muscle looseness, which you get from the pregnancies, also can be dramatically improved by this distance from the front to the back. You can see how that is contoured.
Wow. All right, let's take a look at another one. And again, this could be multiple pregnancies, not just one. This might be, look, I've had my 4 kids. Now look what it's done to me,
Plenty of loose skin. You can see the waist being shaped, the muscles are tightened, everything looks much better. And the patients they give me hugs when they come to the office, and it also makes me feel really good because I know I've helped them out.
Yeah, well, for a lot of women, it's like you don't know what to do to find clothes anymore. I mean, it's hard to find clothes that fix this. You're going to get a clothes where you're going to buy, let's say, a size 14 pants because that's what you need on top, but your legs might only be a 10. You can never, unless you go to a tailor, you can just never get it right.
Right, they're out of proportion, and we can help that with the proportions.
Amazing. Okay, let's go on and see another one because this just blows me away. The volume.
The side view. And the front to back distance on this particular woman can be dramatically changed by tightening those muscles. And many of these patients have a little liposuction on the hips. You can see the shaping and contouring there. And the procedures are sort of it's a very good regimen now that we do put the patients through. We get them healthy before the surgery. We get them healthy after the surgery. The recovery is fairly easy, and they get back to work within a week or 2.
That's amazing. That's just an amazing, amazing look. And it seems like, for women, think about it, because we've done so much. You brought a beautiful child into the world. You have your family, and to me, that stomach is not a reward. You know what I mean? To say, what am I left with? No fault of my own. It's really genes and genetics. It's so wonderful to be able to know that there's a surgical alternative now to get your figure back in shape, especially if you're doing everything right. And you just can't fix that. It's the skin from stretch marks. It's got to go somewhere. That skin isn't going to go. Is not going to roll itself back up.
That's the big thing. The patients don't know that there is something that can be done. And with Valentine's Day coming up, and a lot of these things can be done to try to make them really feel better about themselves. And it's really a great opportunity now. And everybody with the New Year's resolutions, they all want to have things done. So
and this is what you're going to notice if you are sticking to your resolutions. Like, look, I'm losing the weight, but I'm not liking what I'm seeing after. But you know what? I like to think this is a long winter in this area for a good reason. We're covered up a long time.
Plenty of time to recover.
That's right. Nobody's asking to see anything in here for now. You know what I mean? So this would be a great time to go and think about having this done, since we're all covered up anyway, and use this winter time, for our own advantage. But you need to be, like Dr. Shatkin will tell you, you need to be in good physical shape for something like this. And you do counsel people about that.
Well, we have a very holistic approach to our patients, and if people that come in that are overweight, my goal is to make them healthier, and as an MD, it wouldn't be fair for me to just do surgery and then fix them up and then
let them go,
put them on
right?
their way. They need to be healthier before that, because a lot of times they're overweight because they haven't taken care of themselves. So I really need to try to help them with that. We have a weight management program out of our office. I've got, my nurse has been with us now for 20 years, so she really helps manage these patients, and it's really a way to make them healthier, and that's what our goal is.
Absolutely. We have a phone call for
Excellent.
you. Someone has a question or comment.
Okay.
Hi, welcome to the show.
Hi, this is Tisha.
Hi, go ahead, please.
I just want to know if is it safe, effective?
Right. Well, the safety is always a question in everybody's mind, because you're doing an elective procedure, and you don't want to do an elective procedure that's going to put your health at risk. First of all, if you have any medical issues, we check with your family doctor first. We're not going to put you through a risky procedure that's going to compromise your overall health, because the whole idea is to make you better. We're not going to try to make you unhealthy. But generally, they're very healthy procedures. The procedure, like I said, is usually less than 2 hours. Patients go home the next day. They recover at home. I see them in the office a couple times in that first week, and before they know it, they're back to their normal activities. So it's fairly safe. We've been very successful.
Yes, you have. All right, another phone call. Hi, welcome.
Hi, my name is Lisa. I'm from West End. I got a question for Dr. Shatkin.
Okay.
Basically, around what price range would you think, because you just answered the earlier question, but what are you looking at as far as when you do get abdominoplasty?
Okay.
All right, the price range. Well, first of all, it depends on whether it can be done in the office setting, like a mini tummy tuck, or a full abdominoplasty in the hospital. But it ranges anywhere from about $4,000 to $6,000. And at our office, we have a great financing that we can set up for you through a company called Care Credit. And it just is a perfect opportunity. We have low interest financing and everything. The patients really accept that well. And so it's very reasonable, I think.
Is there any insurance rider?
Well, there are a lot of people that do have the cosmetic rider in Western New York. Teachers, police officers, firefighters, they and their family would have the coverage, but generally it would not be covered unless they have a hernia or other problems with their tummy, and then that might be a discounted part of the procedure that the insurance would cover.
Something to look into.
Absolutely.
Another phone call. Hi, welcome. Hi, caller, you there? Do we have our caller standing by? No? Okay, maybe you answered their question and they hung up after that. But we also want to let people know that there's a lot of wonderful things going on in your office. You conduct a lot of wellness seminars, a lot of skincare here too. Right. This is important this time of year.
Well, they have to be hydrated and moisturized. That's why we have these wonderful products. These are all private label products that are only available at our office. And the patients really love them, and we're introducing some more products.
That's great.
It's not just, it's holistic. It's everything we do. It's about taking care of the skin, taking care of your health, taking care of your nutrition. And by the way, if you want surgical procedures that we can correct from a plastic surgery standpoint, by all means, this is what we so.
Yeah, it's great. And you have a wonderful staff, too.
Oh, yeah.
Who's there, they're considerate,
Well, they're answering the phone right now,
absolutely. I hope so, because I think we got a lot of people interested. It's an interesting procedure, and if that's where you're headed, you couldn't go to a group of professionals than the Aesthetic Associates Center. Now, they're located at 2500 Kensington Avenue in Amherst. Pick up the phone. Do yourself a favor this new year. Be ready for Valentine's Day, 839-1700. This might be just the thing to get your new year off to the right start. 839-1700. They're there to help you. Answer the phone, answer your questions. Thanks, Dr. Shatkin. A lot of great information this morning. And this preceding segment and images used were brought to you by Dr. Sam Shatkin and the Aesthetic Associates Center.